Immunization, that is the process of giving vaccination to children to protect them against serious infection diseases, has been proven to be one of the most cost-effective public intervention in the field of child health care. Millions of lives are saved because of immunization every year, and it has led to eradication of many serious diseases like smallpox, polio, and even tetanus in newborn and mothers. Last week of April is celebrated as World Immunization Week in order to reinforce our commitment to provide vaccination for each and every child. Government of India also launched Mission Indradhanush about 10 years back in order to increase the prevalence of vaccination, availability of new and new vaccination. But despite all these efforts, still parents have lot of questions, lot of queries, and lot of anxiety regarding vaccination. In next 10 to 15 minutes in today's session, we will like to answer these queries for your benefit. I am Dr. Neeraj Kumar. I am Chief Consultant Pediatrician at Motherhood Chaitanya Hospitals, Chandigarh. And we are lucky to have two very senior pediatricians with us today. Dr. Vivek Walia, who is Senior Consultant Pediatrician at Motherhood Chaitanya Hospital, Chandigarh, with more than 2 decades of experience. And Dr. Navdeep Dhaliwal, who is Senior Consultant of Pediatric Intensive Care and has more than 2 decades of experience. So we will start the question session and take their opinion. So Dr. Walia, let me come to you first. Do vaccines really work? You have 2 decades of experience. Have you seen any change in the prevalence and incidence of diseases?
Yes, we have seen that after the introduction of vaccines over the last few decades, there has been significant decrease in the mortality, morbidity, and decrease in the incidence of various diseases. As most of our patients or their parents know that few diseases has been eradicated or eliminated. Like the smallpox, which was once endemic, has been completely eradicated from the world since last more than around 45 years. Last case has been seen around in 79. Other diseases, the incidence has decreased, like the polio. The last case of polio, I think it was noticed only few years back in India. And the other diseases, the incidence has significantly reduced, like the chicken pox, the diarrhea cases, which we used to see lot of diarrhea cases, rotavirus diarrhea. And after the introduction of the vaccine, the incidence has significantly dropped.
Very nice.
Same is with the other diseases.
Yes, very good. So Dr. Navdeep, how do vaccines work? Can you just briefly tell for the benefit of our listeners?
So vaccine is basically a modified form of the virus or the bacteria. They are not, they will be introduced in the body, and the purpose is that it will be very smaller dose, and the body will mount an immune response in the form of proteins which we call as antibodies. So whenever the actual infection comes, these antibodies will help fight the person's antibodies will fight with that actual viral or bacterial load, and the person will not develop the actual disease, the whole disease. So it is the priming of the immune system with the intention to produce antibodies, so that in future if the person actually comes with the disease agent, so the full blown disease will not happen.
Very nice. Actually, I read somewhere that antibodies are like soldiers in our body, and antibodies and these vaccines, they train these soldiers so that when the enemy comes, they are ready to fight and protect us from the disease. So, but parents are very worried about side effects. So, do these vaccines really have chances of serious side effects?
See, most of these vaccines, they are introduced in the market after going through various trials. So, most of the vaccines, they are safe, and they have very few minor side effects that are the local side effects. In case of injectable vaccine, there is small maybe pain at the injection site, fever, small swelling is there. Few people, they develop fever or maybe body aches. Generally, the serious side effects are very rare.
So that means we can say that the risk of not taking vaccine is much more than taking the vaccine. Very nice, very good. And very common question that parents will ask that my child has a mild disease, cough and cold. So,
Yes,
can
it's very
vaccination
common.
be given in
Yes,
this
so
situation?
normal, whenever the child is having normal cough, cold or some allergic symptoms, it is not an absolute contraindication to give vaccine. Only when the child is having very high grade fever or the child is sick looking, then only we say, okay, we can delay the vaccine. Normal cough, cold, there is no
It can be.
contraindication. It can be given safely.
Sometimes, what happens is a vaccination, second dose gets delayed. Suppose first was given, second was to be given after 1 month, but it is after 3 months that parent has come. Now, do we need to start the schedule from day 0 or the first dose, or we can continue as usual?
We can continue from the same point of time. There is no need to repeat
So, no need to repeat.
the whole course of the vaccine.
Okay. So that is good. Yeah, that is good. And so many vaccines are available these days, and many times doctors they advise to take multiple vaccines in the same sitting. But parents are worried whether it will lead to more side effects, whether there will be some overdose of antibodies or vaccine in the
Yes, sir,
body.
it's also a very common question.
Yes.
So research and everything has been there. Research has shown that multiple antigens can be exposed. The child can be exposed to multiple antigens at same point of time, and the immune response will also be same. It will not decrease. Yeah, normally we give only 2 to 3 vaccines at particular
Yes.
one particular day,
Yes.
and the next vaccine whichever is due, then we have to wait for another 4 weeks.
So that means any number of
Multiple
vaccines by and
antigens
large
can be given by
can be given. Okay, right. And then there is always a confusion that there is a government schedule, there is a mandatory schedule, there is optional vaccines. What is this concept?
So see, there are basically, we can say there are two schedules. One is the government schedule. In the government normally has to cover large number of population.
Yes.
Yeah. So we can say the other factors like financial factors, they have to look into various things.
Yes.
So and the prevalence of disease in the particular area. So they have, and with time government is adding more and more vaccines also in the
Yes.
schedule
Yes.
as their budget is increasing.
Yes.
So in the government schedule they have to target large number of population, but there are like few vaccines that is not given in the government schedule. Ideally it should be given, and in the focus is on the large population, whereas in the IAP schedule the focus is on the individual child.
Right.
So slightly more vaccines are given. So ideally we should follow the IAP schedule and try to cover more and more diseases
So that means
Yes,
the
possible.
ICP schedule is kind of ideal, which is best for that particular
at this
child.
particular child.
And government of course has to take the community, the available finances with them, the manpower, the logistics
Yes.
basically, and then they keep on gradually introducing these vaccines. Absolutely right. So now how as a parent I can choose where to get the vaccination done, because even chemists are giving vaccinations, many camps are held. So
Yes.
how can I ensure that everything is fine?
So basically, vaccines are kind of very sensitive, you can say, drugs. They need a particular amount, kind of temperature control, like just 2 to 8 degrees. And nowadays, research has shown that domestic refrigerator is not the ideal ones, which we normally see in chemist shops.
Yes.
Because multiple times they have to open for other drugs also. So that the cooling effect of the vaccine will be lost and they might lose their efficacy also. So this cold chain maintenance is the pediatricians or the physicians are more sensitized,
Yes.
and they will do their best to keep the vaccines alive into that temperature range. So ideally you should get the vaccines
Yes.
from your pediatrician or physician who knows that cold chain maintenance.
Absolutely. And I don't know whether chemists are really rigorous to give injection, or it is nursing staff only. I think chemists are also not allowed to give injection, but of course in India many things can
Many times we have seen people have taken
Yes.
chemist say Lelia and then
Ah.
in the bag they have put no ice packs, nothing, and they
Yes,
come to
yes.
your OPD and then keep vaccine लगा दो.
Yes.
ये तो आधे घंटे से we are just roaming on the roads.
And it is very important that you take the vaccine from a credible site only, credible physician, your pediatrician, whom you have full faith in it. Now we come to some specific vaccines. Suppose a 7-year-old child has an injury, and now we have to think whether tetanus is required or not. And at 5 years, the child has got a booster of DPT.
If the child has all the doses of vaccine and that, like you said, he received 5-year dose of DPT, So there is need to give tetanus vaccine in case of trivial injuries.
Okay,
So
so how long
ideally-
the effect lasts?
It can last up to 5 years. So next
Okay.
dose we have to give at around 10 years of
So
age.
that is a good information, because we see so many, parents who come who tell that even doctors also, or chemists also told them it is 6 months, so now a TT is required. So the effect lasts for 5 years. That means if a child is vaccinated, total vaccination is done, you don't require a TT in the routine whenever injury is. Okay. Then there is a question of flu vaccine, because every year flu vaccine is given, and parents think every year it is required, why should I take it? Is it really important to take flu vaccine?
Actually, with flu vaccine, the strain is changing every year, and it is very dreaded disease also. Sometimes the child can land up in ICU. So definitely it is recommended. Initially we used to say it is for first 5 years,
Yes.
but nowadays even elder people more than 60 years or who have some chronic diseases, they also like lung diseases, kidney diseases, they also should get this flu vaccine. And since the strain changes every year, so we need to give.
Yes, especially we have all heard of swine flu, then of course this COVID was there. So all these are flu or influenza infections. And flu is an antiviral or anti-influenza vaccine which protects against the common prevalent infections. And virus causes all kind of diseases. It can cause brain infection, it can go into the lungs. So it is important to take by young children as well as other high risk groups. If suppose some children have specific diseases like heart disease, asthma is there, or in pregnancy or in elderly where immunity is less. So annual flu shot is required. And pulse polio, it has been continuing for many decades. Does a child require now once the vaccination, the routine vaccination is given?
So ideally the child, if the pulse polio campaign is held, ideally the child should receive the OPV vaccine till 5 years of age.
Right.
The purpose in that case is something different. Maybe in the vicinity there is some polio-like
Yes.
illness case has been detected. So ideally
So
we should
that-
try to participate.
So that means this pulse polio are not given because your child may not have got the routine vaccination. These are additional doses for
To
overall
increase the
community,
immunity.
community benefit. And now coming to the last question, a lot of news, even government leaders are saying about HPV vaccine. Can you tell us briefly about what is this?
HPV basically it's a viral infection. It generally causes cervical cancer in girls, and it is not only that this causes cancer in girls, it can cause diseases in boys also. So like penile cancer or some warts, and it is a very dreaded disease. And so there are 4 strains of HPV virus vaccines. The 4 are basically for the girls, and if I'm not wrong, and another 2 are basically for boys. So definitely nowadays, previously we used to say it is only for girls, but it is not. It is now for boys also. So before they go to college or before they go to adult life, so they should get these kind of vaccines to prevent the cancers and.
So HPV, it is a vaccine which protects against cancer.
Yes.
Other vaccines are for infections. And it is supposed to protect against 6 to 7 types of cancer in girls as well as boys. So we must take this vaccine also. So I think we have taken a
So
lot of-
initially
yes.
we were giving to girls this vaccine,
Yes.
but now there are the few brands which are available and which is recommended for
For
boys
boys
also,
also. Very
to
good.
protect them from oropharyngeal cancer, penile
Yes.
cancer.
Yes.
These
I think
brands are
this
available
was recommended in developed countries since last many years.
many years.
For India now it has
So now
started.
it is started.
Wonderful, wonderful. So I think we have tried to take a number of questions in this short session, and I thank Dr. Vivek Walia, Dr. Navdeep Dhaliwal for taking out time and giving us this useful information. Thank you.
Thank you.
Thank you for attending the session.